Welcome back. Now, cardiopulmonary resuscitation, known as CPR, is a life-saving technique useful in many emergencies. When a person has a cardiac arrest, survival depends on immediately getting CPR from someone nearby, and almost 90% of people who suffer out of hospital cardiac arrest die. Now, CPR, especially if performed in the first few minutes of the cardiac arrest, can actually double or triple the person's chance of survival. Joining us on the show is a consultant cardiologist, Dr. Monisola Adanija. Welcome to the show.
Thank you.
Thanks for coming again.
Thank you.
Last time, we know you taught us the last time how to do the CPR procedure, but recently a lot of famous people have died because of heart attack. Family members are having heart attack issues. So we thought it was key for us to bring you back again to teach our viewers the first aid, what the first thing to do once somebody's doing the heart attack thing.
My chest.
Yeah. So tell us first of all, what exactly is it, and how do we even suspect somebody's having an attack?
Okay, a cardiac arrest is said to occur when the heart suddenly stops beating, okay? And when that happens, whoever it is usually drops to the floor and is usually unconscious, okay? And is unresponsive. So when that happens, you know that, okay, we need to do something fast. Now, it's important we act really fast, because within 2 to 5 minutes of the heart stopping, the brain dies, okay? So the CPR is meant to keep the blood flowing to the brain until when help comes. Either a professional comes along to help the patient, or you get an ambulance, and the ambulance can take over and take them to the hospital. Now, when a patient has a cardiac arrest, that is not the time to start shouting and screaming, and you have to be calm and in control so you can help the patient, because the longer you wait, the more likely it is that that person is going to die.
How do you know it's a heart attack? Because anybody can drop dead because of seizures or anything. How do you know this is a heart attack?
Well, a cardiac arrest can be due to so many things, not just heart attack. Okay. So when a cardiac arrest happens, the patient has, in quote, fainted. The patient is on the floor and is not breathing. Okay. A heart attack, the patient mostly is still conscious, is still speaking to you, but clutching his chest. That's a different thing entirely. Okay. Those are two different scenarios.
Okay. Right. So now, I think what is going to be our. But are there any questions concerning this?
But wait, what's the difference between when the person is clinging to the chest and when the person just drops?
Okay. Now, when there's a heart attack, okay, or a myocardial infarction, the heart is still pumping. It's just that some blood vessels in the heart are blocked, so blood flow to the heart is reduced and the person has pain. Okay? When there's a cardiac arrest, the heart stops.
Wow.
Although a heart attack can lead to a cardiac arrest as well, but there are other causes of cardiac arrest apart from heart attack.
So apart from heart attack, what are the other causes
Different things: hypertension, cardiomyopathies, when someone loses blood, electrocution, when someone is choking and there's reduced oxygen to the brain. There's so many reasons why someone can have a cardiac arrest.
So my friend that just died, they said it was a seizure. Her family blames the hospital, that the hospital are the cause of her seizure.
Was she having seizures before?
No, she wasn't. She had been diagnosed with a brain tumor within 2 weeks ago, and suddenly she just died. Nobody was expecting her to die. What is a seizure? How is a seizure different from a heart attack?
Okay, a seizure is like a convulsion. It's when it's a cause from the brain. When you have a problem with your brain, whether a brain tumor, or you have a scar in your brain, or you have any metabolic issues with your brain, the brain, how do I say it, overfires, to make it sound easy, and your limbs jerk, and the person is unconscious. That's different from when the heart stops. In a seizure, the heart is still beating. Now, when someone has a seizure, the person may vomit and aspirate and choke.
Wow.
And the heart can't stop because of the choking. Okay. Or when you have a seizure, your windpipe can close up and reduce oxygen to your brain, and then you can have a cardiac arrest. So that can happen.
How effective is CPR? I mean, if we learn the CPR technique, how does that save the person's life, or we still have to take the person to the hospital immediately?
Some patients may wake up, but the CPR really is to preserve life until help comes, until an ambulance comes, until the doctor shows up. Now, a lot of studies have been done in the US about how many people's lives can be prolonged. Now, it's been shown that over 30% life survival, for people who were given CPR compared to those who didn't get CPR at all when they had a cardiac arrest.
Interesting. All right. So we're going to have Uwa get up now.
Oh, I can't get up. You see, we should, what's it
You
called?
don't have to clutch your chest.
Eh?
Just
Oh,
have the cardiac arrest.
I should just
So, okay, so you're not having a heart attack, you're having a cardiac arrest.
Yes,
You just
due
drop.
to whatever reason.
So yeah, drop. Yeah, come on, yeah, drop.
Jehovah. Okay.
Yeah, stand up and drop. Now.
You should drop where they will see you properly, Joe.
Yeah, drop. Baga.
Hey, madam.
And me, I'm the sister. Hey, wait,
Okay, so when somebody like goes unconscious, the
never
first
die.
thing to do, you need to
Calm down.
calm down, okay?
They're going to shout around you.
This is not the time to shout and scream and yell. You need to give the person space because everybody tends to crowd
Yes,
the person. So you need to clear
Everybody.
whatever is around.
Okay.
And then you as the resuscitator, you need to be sure that you're in a safe place. If the person faints on an expressway, for example, you won't do CPR in the middle of the road in case a molo is coming.
Yeah.
So you have to move the patient to a safe place.
Okay.
You know, you need to clear the area.
Okay.
You know, once you've done that, you have to establish that the patient is actually unconscious. So you call the person.
Ooh,
Hello? Can you hear me?
Ooh, I get up.
So she's not responding. So
Can
it's
you
safe
kick
to
the person
assume.
like this?
No,
Let-
you may
let's-
cause more, you may
let's
cause more
get this.
injury. So it's safe to assume that
Okay.
she has had a cardiac arrest.
Okay.
Okay. So you make sure she's breathing. Okay. So you can put your finger on her nose.
Okay.
You know, feel the air,
Yeah.
or you watch to see if her chest, you know,
It's going up and down.
is going up and down. If that is not happening, okay, if you can feel the pulse, you may, but most people can't, so I won't even
Okay.
go into that.
Okay.
So the next thing you do is position the patient properly.
So you've seen that there's no air coming out from her nose.
Yeah.
So you know that this lady.
And then you watch if her chest is rising
it's
or
not
falling.
rising, okay.
You know that she's not breathing, okay?
Okay.
Then you position her properly. Now, traditional CPR takes compasses two components: the chest compressions and the what you call the mouth-to-mouth breathing.
Okay.
Now, because many people are not comfortable with doing mouth-to-mouth for perfect strangers, they would rather not do the CPR.
Okay.
So we now decided that okay, let's just do chest compressions.
Okay.
You don't need to do mouth-to-mouth if you're not sure who the person is. The chest compressions can keep the heart circulating, the blood circulating without the breathing. So what you do is you lock your fingers together,
Okay.
as so. You place the heel of your palm on the patient's sternum.
Okay.
Okay. You keep your elbows locked and your wrists locked.
Okay.
The motion should be from your shoulders, not from
Okay.
your elbows. So it's not like this.
Okay.
It's this. So you compress the chest,
Gotcha.
okay, as fast as you can,
Okay.
while you ask somebody to call an ambulance
Okay. A call.
or
Call
get help.
767.
767 112.
Now, if it's
Can I come and try?
yeah, sure.
See if
So
I
you keep
can.
doing that until the person wakes
Until the
up.
person either wakes up or you get somebody.
Okay.
Oh, sorry, something very important I forgot. You need to make sure the person has nothing
In their
blocking
mouth.
the airway, maybe vomiters or something.
Okay.
You can clear that out at first.
Like this.
So you lock your
Why can you
fingers.
come to that? People can see you. We can't see you that way.
Never die.
You can do it from there even. Okay. So you lock your fingers. Okay. Put the heel on her sternum.
I know this is your panty. You have to remove it.
Her sternum is the hard bone here.
Okay.
Okay.
So you lock your fingers,
Okay.
straighten your elbows. Okay, and then
Press.
press down.
Yeah.
Am I getting
Yeah.
it?
Yeah. Wake up now, auntie.
So that's just it. So you do that
Yeah.
quickly
Okay.
until help comes,
Until help
an ambulance comes or a doctor comes and
you
that
don't
can
like the
help the patient. And then when the patient, if you're lucky and the patient wakes up, then you lie the person on the left side
Okay.
to ensure drainage of whatever secretions is
Okay.
in the person's mouth until when
Oh, fantastic. Thank you very much. All right, so
How speedily do you do that? Because I saw that you went fast. YK went a little bit
yeah, you should go
slower.
as fast as you can.
So
as fast as you
Maybe
can.
I'm
You should go
learning
as
now.
fast as you can.
So to save the person's life, you need to continue.
You need to continue because the process of compressing the sternum helps the heart pump
Okay.
and helps the blood circulate and helps get blood to the brain.
Oh, my chest.
It was painful,
I have
sorry.
a problem. Now, if you say that this thing should happen in space of
2 to 5
2
minutes.
to 5 minutes, and the place is not
Conducive.
before you carry, would that time not
Define conducive. What you need is a
Like-
flat surface.
okay, just a flat surface?
So if the person is in the
Like
middle
on
of the
the
road,
road,
for
just
example,
move to
just
the
move to
side.
the side of the road.
Okay.
You don't have to move to a house
Yeah.
Okay.
or to a building.
Okay.
Just right there on the pavement. Just
Okay.
move away
I-
from cars.
I think it's key that our viewers understand that you have to do this in before 5 minutes, between 2-3 minutes.
Right when it
Right when it
happens.
happens. So you have to hurry up. Yes, Michael.
No, because you said you should put your hand to the nose. But I will watch
confirm.
it because in films, I don't know, in films you see all those policemen just do.
They are feeling the pulse.
Feel the pulse.
Doctor, let me
If I
quickly
want
take
to
this
teach
call.
you how to, okay.
Let me take this call. From Abulu Egba. Good morning. Are you there? Lekon.
Morning.
Good morning. Please go ahead.
Yes, good morning. I'm
Morning.
a first-time caller.
Welcome to the show.
Yay.
Yes, I just want to appreciate you, ladies. You are doing wonderful. Thank you.
Thank you very much.
I'm so blessed that you are blessed to my generation. Thank you so much.
Thank you. Okay, I thought you had a question. Thank you, Lekon. Appreciate it. All right, so thank you so much, Dr. Danija. I have to let you go now because we need to also teach people how to have some right exercises to help strengthen, especially, so if you're diagnosed with a heart disease, it's key. What can you do to prevent a heart attack or a cardiac arrest?
Okay, first of all, you need to use your meds. Follow all the instructions your doctors give you. And it's really important for a healthy heart for you to be at a healthy weight. Now, for you to be at a healthy weight, you need to exercise every day.
Yeah.
Thank you, Dr. Danija.
So we're going to learn to do the right
The right
exercise.
exercise now.
People like me, I'm trying. I'm making an effort.
I'm not talking to you at
I
all.
know you're not talking to me. I know. I'm not talking to Morel. Because my husband exercises. He said, Morel, at 60, I'm not going to carry you. I will not carry. So if you don't start exercising now, because don't tell me to carry us, because I'll just be looking at you. What he told me that I'll just be looking at you. So now I'm hearing myself brain to start exercising. But thank you very much, Dr.
Thank you
Danija.
so much.
Thank you for having me. Thank
We're
you.
going to take a break right now. As we said, we're going to have Sheyi, our official exercise instructor, will be here in a few minutes to teach us cardio exercises to help strengthen our hearts. Stay with us. We'll be right back. Welcome back. Now, most sudden death is associated with heart disease, and exercise, we believe, is one of the best prevention of cardiac arrest. Joining us, as I said earlier, to take us on this aerobics is a wellness and fitness expert, Sheyi Olushoye. Welcome to the show, Sheyi.
Thank you very much.
Sorry, I
madam.
can't join you. Today is one of those days I just can't join you. But you can just join the show and to watch these various steps he's going to teach us. So Uwa, YK, and Jumake are ready. I think I should even excuse you people. So you don't come and hit my face. Let me sit in that corner. But yes, so you have the show, you have the floor, Sheyi.
Yeah, basically we're just doing cardiovascular movements, and a little exercise is better than none. So it's just going to be dancing, and dancing is a very, very good way to exercise your body and helps with the upper part of your system. Okay? So I'm going to be stretching first. You know, it's always good to stretch so that you don't wear or tear any muscles. So up, go this way. Now this left hand, put it right here. Good. Back. Let's go to the right. Yeah, I had that. Let's go. Let's go. Good. Now hands on your waist. We'll go this way. Now, that's it. 1 and 2. Other way. Good. Good. All right, still your hands on your waist. Now roll your head this way. Other way. Good. Now this is something I want you to try, like this.
Sheyi, don't start.
Stability and balance. Now stretch, bring it. Good. Nice one, let's go. Stretch. Good. So I'm going to take it back to this way. Now go forward. Yeah. Good. All right. The other way. Let's go forward. Stretch.
I can't laugh at you because I'm not doing my own.
All right. Okay, good. Now we're going to be, this is where your heart is going to be pumping.
Yeah.
You're going to make sure your heart rate is beating so fast. So just start with the regular jumps.
This is what you want me to
Okay. Now we could just mix it with jumping jacks like this. Good. All right, forward.
Yeah.
So we're working with the beat, yeah? Now we're going to cross, cross, forward, cross, cross, cross. Good. Good. All right, go, 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 go. We're dancing, yeah? To the left, to the right. Left, right, left, right. Go. This, 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 this. Go, 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 go. This. Good. Good. One more time. Go. This. Go.
I like this one.
You're squatting, yeah? Squat. Good. Go. Good. One more time. Go. Like this. Let's go. Push it. Push it. Push it. Push. Push. All right, push. Good. 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 Up. Up. Bounce. Up. Up. Bounce. Bounce. Now go this way. See, you're twisting your waist, yeah? This way. Good. Good. All right, let's go. I'm sure your heart is beating fast right now. All right, we'll close it. So go this, okay. All right, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. All right, back, back, back. Go.
This is nice.
I'll go. 1, 2, 3. 1, 2, 3. Tap. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now we're gonna be squatting now. Just go. This. This. Good. Sit. 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 Good. Sit. One more time. 3, 2, and 1. All right. Good.
Woo! You guys did a great job. Sorry, YK.
All right.
Pele.
My heart is pumping.
Is it? All right. So we're still continuing. All right. Are you ready? 5, 4, 3, 2, 1, 2, 3, go. Go. Now see him. One, 2, 3, go. This. All right, let's shake it now. Good. Go. Go this way. Good. All right. Go. All right, go this way. One. Let's go down. One more time. All right, shout hallelujah. Let's go. All right, let's go this way. Back. To the right. All right. 1, 2, 3, go. This. Hey. Go. Eh? All right, go. Change.
That's
One more time. Okay, back.
Okay, don't fall
All right,
down.
go.
You need just recovery.
All right, we're shaking.
Ah,
Go.
so you take a easy, bag.
All right, just bounce on it.
Okay, let's take. We need a commercial break. Okay, take a deep breath. Welcome back. All right, so we're going to continue with the second part. Oh, are you that tired? Yes. Yeah, stand up, please. No vex, please. Get up. Go and join them. Sorry, me, no, I'm not in the state of mind to exercise today. So they've exempted me. Oh, yeah, music, please.
All right, ready? Okay. All right. All right. This way. Eh? All right. Go. What's moving on my legs? I'm bouncing on it.
Okay, with attitude.
All right, let's go. 2 hands. Go. Go. No. Yeah. Yeah. Go. All right. Hey, let's go, let's go, let's go. This way, 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 this way. All right, this way, this way, this way. Go. 5, 4, 3, 2, 1, 2, 1, 2, 1, 2. All right, go. Go. Change. All right, go just press this leg like this. Go.
Ah, I hate this one. This is one exercise I hate.
5, 4, 3, 2, and 1. Let's go. 5, 4, 3, 2, and 1. All right, go. We're dancing and exercise at the same time, remember? Go. Yeah. This is for your obliques, your side. Yeah, good. All right, up. All right, just shake it up. Shake, shake. Go. Shake. All right. All right, like. Other way. Other way. Okay.
Whoa.
All right. What's it dancing?
There's two more.
All right. All right. Hey. Bounce. 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 Are we ready? 5, 4, 3, 2, 1, go. Hey. Go left, left. Right, right. Left, left. Right, right. Go. Alright. Okay. Alright. You dab. 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 Now punching. Punch. 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 Now see. Right. Hey. Yeah. Now. Ready? All right. Go. Go. All right. Fine. Go. All right. Roll it.
Take it easy, oh, please.
All right. Go this way. Go. Now let your heels touch your butt. Go. Go. Hey. All right. Like this.
Okay, let's start rounding up. Start shading.
All right. All right, just round up. I can hear what's breath right now. All right. All right. This way. All right. Go. All right, let's go. We're running off. Running off. Now just freestyle. Just freestyle. This is your time. Freestyle. Freestyle. Go. Let's freestyle. Okay. All right.
Fantastic.
Good job. Good job.
Well done.
Good job.
So from what our doctor said, because the objective of this is really to help us get the heart pumping. From what Dr. Danija told us is that obviously we need to also be exercising. Exercise is key.
Yeah.
Now, how often or how long do we need to do this? I mean, this was only about 20 minutes or 15 minutes.
I know
Like
it's recommended you do this every day.
Yeah.
You do this every day. If you can't do it every day, just do it at least 4 times in a week. Okay. A minimum of 30 minutes. The goal is to keep your heart pumping, because when you keep your heart pumping and get it so fast, you burn calories and the cholesterol around your heart, melts. So this is what you should do. It's a lifestyle. It's not something you start and stop. What?
Why are you out of breath?
Yeah. So it's just a little exercise is better than none at all. And you're not in
But
competition
we see
with
some
anybody.
people, I wish the doctor can come and say a few words, because we see some people that are really, really fit.
Yeah.
They exercise and yet they still fall down and die.
They still
So,
drop dead.
they still drop, yeah, so, I mean, that was a question I should have even posed to Dr. Adeninjo, because, I mean, that happens a lot. The objective is to really help those out there.
Yeah.
Is exercise enough, or feeding?
I think diet is part of it too.
Diet
What
is
you
part
eat
of it.
too. Yeah.
Come, you use Mariam's mic now.
Let me, you can come on the set. So, let me give you an opportunity. All right, so, okay, yeah.
What was
The question is, there are people who actually do exercise.
They're healthy.
They're
but
healthy.
They still fall down and die.
Yeah, but exercise is not the only thing. And it's not just heart issues that make you fall down and die. There's so many other reasons, okay? So you have to combine everything. Exercise, healthy eating, healthy living, no smoking, no alcohol. There's so many things. It's not just exercise. It's not just exercise.
Don't mind YK. You need to stop alcohol. Stop it.
You live once.
All right, but thank you very much, Dr. Danijo. Thank you, Shay. It's always a pleasure
Pleasure.
having you. We have to round up the show. So I hope you've learned a few things today. First things first, we learned from Dr. Danijo how to help a patient or anybody who is having a cardiac arrest or a heart disease. Who's having a heart attack or cardiac arrest. We've learned what to do. That's it. So you don't do this. You do this. Right? You see Dr. Danijo saying, so don't do, when you're doing this, you're doing it wrong. Or you do this. Press like that. Touch your hand, you twist your hands, you touch. That we learned, and then we also learned from Sheyi the various exercises to help with not to kill yourself, to strengthen your cardio, your heart. That's all we can take on the show today. Tomorrow is another day. Have a lovely day. See you tomorrow. Bye bye.
Bye.